a lot of parents today have also asked this in the chat box and also while registering. Do developmental delays necessarily mean developmental disabilities?
No, not every time. See, I work in NICUs. Now, what is the reason for working in NICUs? The child is premature, the child is born IUGR. When I'm seeing the kid for the first time at 3 months, correct. One more thing about the checklist, at least for the early checklist, 3 months and 6 months, it is at corrected gestational age, which means if the child was born premature, then we are doing the checklist from the due date. As simple as that. Okay. So if suppose we have a 3-month-old child who was 3 months premature, then the checklist is not applicable. I should have clarified it. But the question we were going on was that suppose I'm seeing a kid in NICU who is premature, and now I'm seeing the kid at 3 months corrected gestational age, and the child is showing me developmental delay. Now here I'm trying to prevent. This child is at risk for developmental disability later on, but at this moment the child is only showing a delay. So this is the concept of early intervention, that here if we are working, the developmental disability may not happen only.
Right.
So the child may come out, but there will be certain situations in which the early intervention is making the prognosis better. But the early intervention is not preventing the later disability. It is very, very true for situations which are chromosomal abnormalities, Down syndrome. The child is having Down syndrome, so the developmental, some disability is obviously going to be there. Now, because you are providing physiotherapy, occupational therapy, language therapies, whatever therapies the kid needs right from the beginning, you are reducing the magnitude of the disability the child may ultimately end up. But you are not preventing it. Same goes for things like autism. Again, it is a spectrum. So in autism, it will depend on what is the child's own level, what time we caught, what time we started the intervention, how much intervention took place. So many things come in between. So it is individual, case to case. So when we are taking children who are at risk for developmental delays, many of the kids will actually come out of it with no disability later on. And in some condition, we are reducing the magnitude of the delay which will ultimately